Welcome to Impact Signals, social impact at the scale of AI. I'm Charlie.
And I'm Sarah.
It's Thursday, March 26th, episode 41. Today we're looking at AI working at the edges, in Nepal's landslide-prone mountains, in Bogotá's migrant communities, in Lebanon's post-war schools, and in the management of a mental health crisis that most organizations haven't even noticed yet. We start in Nepal. Two mountain communities in Nuwakot and Dhading districts are now running a system called SAFE-RISCCS, the University of Melbourne's AI landslide prediction platform. And the design is important. Residents themselves deploy low-cost rain gauges to collect hyperlocal rainfall data. European Space Agency satellite radar detects subtle ground movement, changes invisible to the naked eye. An AI layer fuses both streams and generates landslide probability forecasts weeks in advance.
This isn't a system where satellites watch from above and scientists interpret results months later. The community data is what makes the AI accurate. The same team has analyzed 300,000 slopes in the UK and mapped over 4,000 landslides following a disaster in Indonesia. Nepal is one of the first deployments in South Asia's fragile mountain environments where landslides kill hundreds of people every year.
The replicability case is strong. The system avoids expensive custom sensor infrastructure. For organizations operating in Bhutan, Bangladesh, or Myanmar, other mountain geographies with persistent landslide exposure, this is a replicable architecture that doesn't require major capital investment to stand up.
From Nepal to Australia. The University of Canterbury in New Zealand published research this week on an AI wildfire forecasting system that updates every 30 minutes. Australia's official Fire Behaviour Index updates once a day.
That gap, 30 minutes versus 24 hours, is the entire problem. Fire weather can turn dangerous within hours. The UC team, led by Dr. Alberto Ardide, tested their machine learning system across the Sunshine Coast, Brisbane, and Hobart, analyzing more than 60 years of historical weather and fire data. Across all three regions, the AI consistently outperformed the standard fire danger rating system by 10 to 30%, detecting significantly more fire events in advance.
And an economic cost-loss analysis found the system could double economic savings by reducing missed fires and cutting false alarm costs simultaneously. The system runs on standard weather station data, no new sensor infrastructure required. That means it's immediately scalable to fire-prone regions in Southeast Asia, Southern Africa, and Latin America.
Now to a story that's Thursday's required recovery beat, and it comes from Colombia. The Mixed Migration Center and the Danish Refugee Council launched a generative AI chatbot called SAMI in Bogotá on March 25th. It runs on WhatsApp.
SAMI stands for Support System for Informed Migration. The team did extensive research first, 4MI surveys, social media listening, focus groups, and found that migrants already rely on WhatsApp and Facebook for journey information. The problem is that unverified information leads people to dangerous route decisions, exploitation, and vulnerability to trafficking.
SAMI operates exclusively from an expert-curated knowledge base updated by MMC and DRC professionals. It doesn't search the open internet. That closed design prevents hallucinations, prevents the chatbot from inventing information about border policies or services that don't exist. It answers questions about legal rights, migration pathways, services, and humanitarian assistance. It operates in Spanish, Portuguese, French, and English.
And with informed consent, it collects anonymized data in real time, giving humanitarian organizations genuine insight into what migrants most urgently need to know, information that's currently largely invisible to program designers.
Organizations running migrant assistance in Ecuador, Venezuela, or Mexico's northern border should look hard at SAMI's architecture. The closed knowledge base model is a replicable ethical template for any humanitarian information service.
Speaking of recovery, today Save the Children published a Land Arc report on Lebanon. It examines the impact of the 2024-2026 conflict on children's lives, education, protection, psychosocial well-being, and recovery pathways.
The findings are stark. School enrollment remained relatively high through the 2024-2025 academic year, but regular attendance was severely disrupted. Most children experienced learning stagnation. The majority received no remedial assistance. Where support existed, it came from families and schools, with minimal NGO involvement. That widening inequality and learning recovery is the gap this report documents.
The UN and humanitarian partners have launched a $308 million flash appeal covering March through May 2026, targeting 1 million people. More than 1 million people were displaced in just 2 weeks earlier this month. The IRC has Lebanon on its emergency watch list.
The policy implication for practitioners? The methodology in this report identifies exactly the use case where AI-augmented education tools, systems like the IRC's Aprendia, which scaled to 4,700 teachers in conflict-affected Nigeria, could be adapted for Lebanon's post-war education recovery.
We turn now to governance and a World Health Organization announcement that deserves more attention than it's gotten. WHO announced the formation of a global consortium of collaborating centers on AI for health, spanning all 6 WHO regions. The launch follows a January workshop organized by TU Delft's Delft Digital Ethics Center, the first WHO collaborating center on AI health governance.
The core finding, generative AI tools designed for workplace productivity are being used by millions of people, including displaced youth, crisis-affected communities, and disaster survivors, for emotional support, in contexts where those tools were never designed and never tested for mental health applications.
Dr. Elaine Lebrique, WHO's Director of Digital Health and AI, framed it directly. AI increasingly interacts with people in moments of emotional vulnerability. WHO AI lead Samir Pujari, the pace of AI adoption in people's daily lives has far outstripped investment in understanding its impact on mental health.
3 concrete recommendations came out of this process. Treat generative AI emotional support as a public mental health concern requiring cross-sector governance. Integrate mental health impact monitoring into AI regulatory assessments. Co-design AI health tools with clinicians and people with lived experience.
For practitioners in disaster response, refugee assistance, or psychosocial support, the WHO Consortium is the first formal institutional signal that deploying any AI in these settings without mental health design and governance constitutes a humanitarian risk. Begin aligning now before the formal standards arrive.
From global governance to a specific African megacity, Lagos deployed an AI-powered flood detection system monitoring waterways and drainage channels across the city's 187-kilometer Atlantic coastline.
Lagos is highly vulnerable. Approximately 25% of its landmass consists of water bodies. Major neighborhoods like Lekki were built on former swampland. The new system provides continuous surveillance of drainage channels statewide, with real-time water level monitoring and early warning alerts before flooding occurs.
What's significant here is the model of implementation. This is locally executed, not a foreign NGO pilot. Lagos State is integrating it with their emergency management system and planning to connect it to urban zoning decisions. For other coastal African megacities, Accra, Abidjan, Dar es Salaam, Lagos is the case study to follow.
And finally, a new preprint from EGU Sphere may change how we think about emergency dispatch during flood events. Researchers in Catalonia, Spain, developed a machine learning model that predicts whether flood-related 112 emergency calls will occur in a given municipality within the next hour.
The model combines rainfall weather data with static vulnerability and exposure layers. Trained on over 6 years of Catalonia data, October 2018 to February 2025, it outperforms traditional climatology-based weather warnings from meteorological agencies, especially in medium and high-density urban areas. It's under review for publication in Natural Hazards and Earth System Sciences.
The key concept here? Using emergency calls as high-resolution impact proxies, not modeling flood probability, modeling whether people are actually going to pick up the phone and call for help. That's a different question with a different answer that's useful in a different way.
For humanitarian emergency coordination, anticipating call volume surges lets dispatch centers pre-position resources and reduce response times before flooding peaks. The methodology is applicable anywhere that has call center data. The preprint is open access at EGU Sphere.
Events for the next 30 days? The AAAI AI and Humanitarian Assistance and Disaster Response Symposium wraps up today at Stanford. RightsCon 2026 runs March 28th through 30th in Nairobi, Digital Rights and AI Governance. The IAAP Global Privacy Summit is April 1st through 3rd in Washington, D.C., covering AI governance and humanitarian data protection. Action on Disaster Relief 2026 is April 8th through 10th, also in Washington. And ACM-CHI runs April 26th through May 1st in Yokohama.
Active monitoring. The Lebanon flash appeal of $308 million is active through May. Gaza flash flooding was documented in a CCCM update yesterday. Sri Lanka is in active Cyclone Ditwa recovery with UNDP's Rapid Assessment Framework running. Chad's food security outlook is deteriorating through September. That's Impact Signals for Thursday, March 26th. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.